Okay, so let's jump into this. You're interested in retinitis pigmentosa, RP, specifically new treatments being explored.
Right.
We know you've been looking into the work of Professor Dr. Suhail Sarwar in Pakistan, who's using PRP and stem cell therapy to treat RP, and that's definitely an interesting area
Yeah, definitely.
of research. While we don't have specific research papers on his methods today, we did find this super relevant study published in Stem Cells Translational Medicine
Oh, cool.
that you'll find fascinating.
Awesome.
It focuses on a 3-year study using a specific type of stem cell, Wharton's jelly-derived mesenchymal stem cells, or WJ-MSCs, either alone or combined with this non-invasive electromagnetic stimulation called MagnaVision. It sounds pretty complex.
Yeah, it is. It's really interesting, though, because what they're looking at is slowing down the progression of RP, which is a group of genetic diseases that cause progressive vision loss.
Right.
So right now, there's no cure for RP, but there's a lot of hope with this research into new treatments like stem cell therapy and electromagnetic stimulation.
And that's what makes this deep dive so important. So before we break down this study, can you paint a picture for us of what it's actually like to live with RP?
Sure. Imagine this. You're out for a walk at dusk, and you start noticing it's harder to see.
Okay.
That difficulty seeing in low light or night blindness is often one of the first signs of RP. Then over time, your peripheral vision starts to shrink as though you're looking through a tunnel.
Wow.
Eventually, for many people, RP can lead to complete blindness. It can be a really challenging diagnosis, and that's why this kind of research is so crucial for offering hope and potential solutions.
It's heartbreaking to imagine. So let's get into these potential solutions. Tell us a bit more about these WJ-MSCs and how they're being used to tackle RP. Are they like mini mechanics going in to fix our eyes?
Well, not exactly. They're more like tiny repair crews. WJ-MSCs have this amazing ability to release these substances called growth factors and neurotrophins, which can protect the photoreceptor cells in the retina. Those are cells that are damaged in RP. They can also potentially help reactivate some of the damaged cells, which is pretty remarkable.
Wow, deactivate damaged cell. That's incredible. Okay, so we've got these WJ-MSCs working their magic. What about MagnaVision? Where does that fit in?
So MagnaVision is all about electromagnetic stimulation. It uses something called repetitive electromagnetic stimulation, or REMS.
Okay.
And it's thought to influence the activity of ion channels in cells, which could boost the effects of those stem cells and maybe even help them reach their targets more effectively.
Okay, I'm seeing the picture here. We've got the repair crew, the WJ-MSCs, and then we've got MagnaVision acting as their trusty guide. I'm really curious to know how they designed this study to test out this combo approach. What did they do?
So they took 80 patients with RP and divided them into 4 groups. One group received only WJ-MSCs, another group received only MagnaVision, the third group received the combination of both, and the final group acted as a control receiving no treatment.
So 4 groups, each with a different strategy. Makes sense. And they followed these patients for 3 years, right? But how did they actually track the progression of RP? Like, how could they tell if the treatments were actually working?
They used a few different methods. One was fundus autofluorescence, or FAF, which maps the retina and shows how many of those photoreceptor cells are still functioning.
Okay.
They also did standard visual acuity tests, reading letters on a chart,
Right.
and checked the patient's visual fields to see how much peripheral vision they were losing. And finally, they used electroretinography, or ERG, which measures the electrical activity in the retina.
Okay, so they had all these different ways to monitor the patient's vision over time. This is where it gets really exciting for me. What did they find? Did those treatments actually make a difference?
Here's where things get interesting. All of the groups experienced some vision loss over the 3 years of the study, which is kind of to be expected with a progressive disease like RP. But the rate of progression, that's where we see the big difference.
Okay, so spill the details. How did each group do?
Well, as you might expect, the control group, the one that didn't receive any treatment, had the fastest progression of RP, meaning they lost the most photoreceptor cells over those 3 years.
That's sadly not surprising. But it helps provide a baseline for comparison, right? What about the groups that got the WJ-MSCs and the MagnaVision?
Right, so both the WJ-MSCs only group and the MagnaVision only group showed a slower rate of vision loss compared to that control group. So each treatment on its own had a positive impact, which is encouraging.
That is encouraging, but I have a feeling the real star of the show is the combination therapy group, right?
You're absolutely right. The group that received both the WJ-MSCs and MagnaVision had the slowest progression of RP out of all the groups. That means they retained more of their vision over those 3 years.
Wow, that's really significant. Combining those 2 treatments really seems to make a difference. This has given me so much hope for people who are living with RP. But hold on, didn't the study mention some side effects too? I vaguely remember something about foggy vision and flashes of light.
Yeah, you're right. Some patients in the WJ-MSCs only group did report experiencing temporary foggy vision and flashes of light, But it's really important to emphasize that these side effects were short-lived
Okay.
and most likely due to those stem cells getting to work in the retina.
So nothing too serious or long-lasting.
Exactly. And here's the best part. There were no serious side effects observed in any of the groups, including the one that received the combination therapy.
That is good news, especially when we're talking about a condition as serious as RP. But, no study is perfect. What were some of the limitations that the researchers pointed out?
You're absolutely right. One key limitation was the sample size 80 patients is a good starting point, but we really need larger studies to confirm these findings and get a more comprehensive understanding of the treatment's effects.
More data is always good. What else should we keep in mind?
Another thing to consider is that RP is actually a whole bunch of different diseases, all caused by different genetic mutations. The study didn't specify if everyone had the same mutations, so it's possible the treatments might be more or less effective depending on the specific genetic makeup of each person's RP.
That makes sense. So we need more research to see how these treatments work across the different types of RP.
Exactly. But even with those limitations, these findings are truly promising. It suggests that combining WJ-MSCs and magnivision could be a real game changer for people with RP.
It really does feel like a turning point. This deep dive has been so eye-opening, pun intended. But before we wrap up, I want to bring it back to our listener who I know is particularly interested in Professor Sarwar's work using PRP and stem cells. While this particular study didn't involve PRP, it does highlight the growing interest in stem cell therapies for RP, which is definitely encouraging. What are your thoughts on that connection?
Yeah, it is. It's fascinating to see how different researchers are exploring various approaches to treating RP. Professor Sarwar's work with PRP, which stands for platelet-rich plasma,
Right.
is another exciting avenue. While PRP isn't the focus of this particular study, it highlights the broader trend of harnessing the body's own healing mechanisms to address this complex condition.
And it speaks to the fact that there's so much we still don't know about RP and its potential treatments. But that's what makes research like this so exciting, right? It opens up these new possibilities and gives us hope for even more effective therapies in the future.
Absolutely. And, even within the scope of this study, there's still so much more to explore. This research focused on a 3-year time frame. But what happens after that? Could continued treatment with WJ-MSCs and magnivision continue to slow down the progression of RP or even lead to some degree of vision restoration? That's a really intriguing question.
It is. I mean, we know stem cells have this incredible ability to repair and regenerate tissues. And we're learning more and more about how electromagnetic stimulation can influence cellular activity. So it's not a stretch to imagine that continued treatment might yield even more remarkable results.
Precisely. It might not just be about preventing further damage, but actually giving those photoreceptor cells a fighting chance to recover. And think about the potential for personalized treatment approaches down the line. As we learn more about the specific genetic mutations that cause RP, we might be able to tailor treatments to each individual's needs.
That's personalized medicine in action. And it's mind-blowing to think how far we've come in RP research and how much potential there is for the future. But, while we wait for those future breakthroughs, it's important to remember that there are things that people living with RP can do right now to protect their vision. Things like wearing sunglasses to shield their eyes from UV damage, maintaining a healthy diet, and getting regular eye exams.
Those are all such important steps. Knowledge is power, and the more you understand about RP, the better equipped you are to manage the condition and advocate for your own health.
So true. This deep dive has really illuminated the path forward for RP treatment. Even though it's not a cure, yet these findings give us real reason to be hopeful. It shows that researchers are making progress and are dedicated to finding solutions for people living with this challenging condition.
And to our listener, I encourage you to stay curious, keep learning, and don't be afraid to ask questions, because who knows, maybe you'll be the one to unlock the next big breakthrough in RP treatment.
What a great note to end on. We've covered a lot of ground in this deep dive, and we hope you found it as fascinating as we did. Remember, while RP presents unique challenges, there's a growing community of researchers, doctors, and individuals like yourself who are working tirelessly to find answers and improve the lives of those affected by this condition. Stay hopeful, stay engaged, and keep those eyes on the horizon.